So the easiest way to take your brace off is to use these clips here on the side, as opposed to undoing all the Velcro every single time. I'm going to take this off and show you how to adjust it. So this dial on the side here is what's going to show you how much you can bend or extend your knee. For the most part, when you first had surgery, you're going to be locked at 0. You'll know that you're locked at 0 when this red line next to the 0 and this red line on the arm of the brace are lined up. If you notice that you can't get it in line, one thing is, so it can be unlocked if you move this red dot, this red button, and you want to make sure that you double check that red button often, because sometimes it can just get bumped into the unlocked position and then your brace will be moving, and if when you lock it again you're not all the way at 0, that's going to be bad for your extension, because you're going to walk around with your leg at 30 degrees of flexion, bent like so for a while before you notice, and then you won't be able to straighten your knee all the way. It'll be harder next time you come to PT. So when you are locking again, you just want to make sure that that 0, those 2 red lines are lined up right there, right? If you notice right now they are not. This one's past 0, it's not at 15, but it's past, and that's because this gray button over here is at -10 extension. So this white area here where it says extension tells you how far you'll be allowed to extend your knee. We don't want you going past 0 because we don't want you in hyperextension. So to adjust that, you push this gray button in, you slide it over to the 0, you wait for it to click, and now you'll see that now the red lines line up. So we can go ahead and relock that. So we'll check the other side. We'll make sure that this gray button is lined up with the 0, which allows for the red lines here and here to line up at 0, and we lock it. The flexion aspect, you don't really have to worry about that much currently, because we're not going to be flexing the knee at all. We're keeping it locked at 0 degrees. So when we look at these straps, things to look at. A lot of times once your swelling starts to go down and you take all your bandages off, you're going to want to tighten those straps, and you're going to think, oh, I'll just undo this bit. We'll put it on in a second, and I'll just pull this, but you don't want to do that, and I'll tell you why. Because right here, this strap is attached here with Velcro to the plastic part right here. So when you are going to, and I'll show you when we stand up, when you're going to tighten the wraparound part, you have to undo this Velcro here, slide it to whatever length you want, and then reapply it, and then tighten it here. So you can't just pull like that, or you'll yank that Velcro off. Once that Velcro comes off, it cannot be replaced, and then your brace will continue to slip and fit poorly all the time. So let's lift the leg up. We're going to put this on. We want to put it on when it's locked. That's usually easiest, when it's already locked at 0. We want to line the dials up with the very side of the knee where the knee would be bending. And then I'm going to have you clasp this one at the top. Good, and then the second one, and I'll get these down here. Okay. So here's another thing that's going to happen. As your swelling decreases and you take your bandages off, your leg's going to be smaller. We're going to need to tighten this up. You may end up with a lot of extra material here at your straps, like so, and you may think, oh, it's so much extra, I'm going to cut it. Don't cut it, because invariably you will run out of strap, and you will try to Velcro it back, and you'll end up on a plastic part like this on the other side. So instead of cutting your strap, if you need to shorten this bit, you just fold it in half. This end piece separates like so, and you put it around here, and that's how you'll shorten your strap. And then you can reattach it over there. That particular strap does not currently need to be shortened. Okay, so I'm going to have you stand up over here. And let me raise this up. You're going to face that direction. Good, so we're all locked out. Now, you're a little bit taller than this brace was arranged for. So there are a couple of things that we can do. If you need more stability, or if you feel like your brace is slipping down, 2 tips. 1, you can lengthen this bottom part until it's right above your ankle bone. And you do that by pushing in this gray button here and sliding down. And for the purposes of this video, we will unclasp slide both of these down. I think bring your leg forward for me. Good. So that's how you would adjust the length of the brace. Now that it's lower, I need that strap tighter. So I'm going to pull here and attach this here. So if I had cut that, it would not reach all the way to the Velcro. And we have an issue there that I'm going to show you up here also. So up here you see there's a lot of extra space back here. I can tighten that strap not by tightening this buckle, but this is where we have to look for the Velcro. Turn and face the camera for a second and turn your leg out. We have to look for this Velcro right here next to this plastic piece. And this is where I'm going to tighten the back part, strap in the back, reapply that Velcro, turn towards me, and put that through there. Good, now you see an example of where this is too long. Face the table for a sec. So I'm going to remove this. So I can't attach it because it ends up over the plastic. I'm going to take that off, shorten this up, reapply my Velcro, and we're done. And then I would do the same thing up here with this one. So then also this same thing, just to point out, all of these 4 pieces can be adjusted up or down. So if it was more comfortable or would help it stay better, we could move this piece up a little bit. Additionally, if you find that you have a lot of tenderness just below the knee where you may have stitches, you can also move this piece down a little bit. I'll show what that would look like. Because sometimes that clasp does end up right there and it's kind of uncomfortable. And I think that's everything.